Hi, my name is Austin Fontes, and I'm doing a presentation on treating relationship distress, which is actually somewhat of a misleading title. I'm not going to get too far into the actual treatment aspect in this presentation, but more so, we're going to talk about the benefits of a happy marriage. So, the point of this presentation ultimately is to talk about the lack of coverage for couples counseling. Couples counseling is a widely accessible service, though affordability is kind of an issue for many because insurance companies don't tend to cover couples counseling. And truthfully, that we've come a long way in terms of behavioral health coverage by insurance companies. And this is due to the parity laws. And the first Parity Act of 1996 basically required insurance companies to weigh mental health and physical health the same. And so a lot of behavioral treatment was actually accessible for those with financial barriers, especially, or just general reservations. Even having that insurance is really helpful to get people the care they need. Um, and so that was helpful. And then in 2008, it was updated to include substance use disorders. And so where it stands now is basically any mental health disorder is considered on the same level of physical health diagnoses. However, the issue with this comes in that there are many reasons that people seek therapy and counseling that aren't disordered. So, if someone is feeling depressed, that's different from having depression, for example. And if you don't meet a clinical diagnosis, then there may not be that coverage for you going into counseling. But one in particular, the focus of this presentation is relationship distress with spouse or intimate partner. That is Z63.0, which all the Z codes in the back of the DSM are not covered by insurance. And this is troublesome because a lot of people seek marriage counseling, and a lot of people are limited in their ability to seek that level of care because they can't afford it. However, I do believe, and the case I'm going to make in this presentation is that it is really important. Um, so I want to start from the beginning. So with babies and infants, so infant attachment. John Bowlby, the founder of attachment theory, recognized that infants have great emotional needs, and that the ability of the caregivers to meet those needs really affected the child's development going forward, physically, mentally, emotionally, all of their overall health was affected by this. And especially later on in life, as you get to the point of creating interpersonal relationships, those who had more secure attachments as infants, which means their caregivers were more present, more satisfying those emotional needs as well as their physical needs. They were much more capable in those situations, and they met all their developmental milestones, sometimes even hitting them early. Whereas in attachment styles where the parents haven't been emotionally present, have been emotionally distant, or maybe volatile, and it creates this insecurity for the infant and their ability to attach that is affected their ability later on to create meaningful interpersonal relationships and even missing developmental milestones. It's also well documented that there is a significant level of failure to thrive for infants whose emotional needs are not met. And so what we've seen is that um, infants who aren't emotionally nurtured, um, they do fail to develop physically, mentally, emotionally, and even to the point of death. Some infants can't survive that emotional disengagement, and so it's a deep need for humans. And yet, when we go into adulthood, we seem to ignore this and forget about it and move on. So focusing on that, like how is the attachment helpful as adults? Um, well, there's a lot of ways in which marriage is helpful for our mental health. Married couples experience less mental health diagnoses overall, so there are less symptoms of depression, anxiety, anorexia, substance use. I mean, and the list goes on. And there's also just the fact that married couples report to be happier overall. Not only that, but when in terms of global happiness, marital happiness is the greatest contributor to overall happiness for an individual. There's also health benefits to it. So, healthier habits. Couples tend to eat better, less smoking, less drinking, and they just generally have better overall health. They live longer. Depending on the study, this can go anywhere between 2 to 3 years to as much as 10, as far as how long married couples live. And a lot of that also factors into the quality of the relationship itself. So the better the relationship, the better these outcomes become. They also report better sleep, less insomnia, less fatigue throughout the day, more restful sleep, when sharing a bed with a significant other, an intimate partner. They also happen to recover more quickly. And so there was a study done that found that those who were married were more likely to recover from congestive heart failure. And over a 2-year period, those who were single had significantly higher rates of not only not recovering very well, but even death. And that was present in both groups, but significantly less in the married group, and the recovery happened faster for those who were married. And so there's a lot here. There's a lot more to unpack ultimately. I'll go into my references because I'm out of time. But ultimately, there are treatments that can help marriages, and helping a marriage helps everything else. And so ultimately, this is a level of preventative care that we should absolutely be pursuing and trying to help increase access to. And thank you for your time. That's all I have.